Swadikap. Good afternoon once again. Today is Thursday, the 3rd of March 2022, and this is the English language summary of the press briefing here at the Center for COVID Situation Administration, or CCSA. So thank you to Dr. Sumani for the Thai language version. She gave us some important information. Some of the focus of the presentation, the briefing in the Thai version. One is about the entrance examinations of Thai students in the TCAS system for university entrance. Now, there's an issue there in Thailand because some of the students may have contracted COVID and have light symptoms. Now, the authorities have arranged for their examinations to be able to take place under specific measures and circumstances, which is good news for these students. Also, the issue about the vaccination, there still remains in Thailand a large number of people who have not been vaccinated, up to the millions, of course. So we encourage everyone to get vaccinated, in people from every group actually, most especially the elderly group. There remains a large number who are still not, although as you can see, our vaccination drive is going quite well, and we'll have some numbers about that for you later. Also, Dr. Sumani mentioned about the precaution, the strict measures and our guard, keeping our guard up, especially during this week and this month, so that we can prevent any upsurge of COVID in the middle of April 2022 or middle of next month, which is actually as you would know, the Songkran Festival in Thailand. So I'll start off with the general situation in Thailand. The rise of new infections in Thailand result in the rise of number of severe cases and death toll, particularly for those above 50 years old and or those with underlying illnesses. The CCSA therefore continues to urge everyone to practice universal prevention, as well as to get their vaccination or booster shot as soon as possible, which will help, of course, lessen the severity of the infection. I have a recap on an update on the Test and Go scheme. So allow me to reiterate that the Test and Go regulations from the CCSA General Meeting has been adjusted starting on the 1st of March 2022. And you have an infographic guideline for you there on screen, which can of course be found on the social media pages of various government agencies. So travelers entering by air, land, and sea through the Test and Go will no longer require the second RT-PCR test and hotel stay on the 5th day. Travelers can do the self-ATK and report the test result via the Moshana application. And note that travelers still need to show proof of payment that include the day 1 hotel stay, an SHA extra, AQ, OQ, AHQ, with RT-PCR and transportation, as well as the ATK test kit. The minimum health insurance coverage has also been revised from $50,000 US coverage to no less than $20,000 US. And further review of these updates and measures will be made around the month of April next month, 2022. And of course, after the first RT-PCR test at the hotel, if the result is negative, you are free to travel as planned. And on day 5, after taking the ATK test and reporting the result on the Moshana application. Yes, so just an update on the arrival of travelers. We'll turn to the usual updates on this. We're in the beginning of the month of March now. So during the 1st to the 2nd of March, the past 2 days, we have 15,625 incoming travelers total entering Thailand. And to break that down, of this number, the majority, around over 13,000, you can see that the exact numbers on the screen, over 13,000 travelers continue to enter via the Test and Go or the quarantine exemption scheme. And over 2,000 entered via the Sandbox scheme. And we have 323 entering via the alternative quarantine system, meaning those who are unvaccinated, vaccinated, or those not fully vaccinated. And the majority of international travelers come from top 10 countries of origin. During the past 2 days, the beginning of this month of March, we have the UK, Germany, Singapore, Russia, France, the US, UAE, Kazakhstan, Australia, and Israel. Now, for the general situation, we'll turn to the situation in Thailand in particular. We have new confirmed case at 23,618. Active cases well above 200,000, as you can see. New recoveries, 18,939. Perhaps around 3 or 4,000 less than the new confirmed cases. And unfortunately, new fatalities reported is 49 new fatalities. New infections and clusters continue to come from restaurants, markets, schools, factories, and religious rituals. I'll move to the provincial breakdown. The breakdown of the top 10 provinces with COVID cases. So you can see on screen there, I would have to go through every province or city for you, but you can see that Bangkok, Chonburi, and Nakhon Si Thammarat remain at the top 3 of the top 10 provinces. And of course, in green is less than the previous day. We have Bangkok less than the previous day, and in red more than the previous day. I guess if you look at the chart right now, it's around half are green and half are red. So the numbers are fluctuating. In some provinces, less than the previous day and getting lesser. In some provinces, more than the previous day. And the concentration, of course, aside from the central region, we have in the southern part of Thailand as well, and one province from the Isan region. So on vaccination progress that I mentioned just now, yes, we have a slide coming up for you on this. So reported for today, administered 150,694 doses of vaccines. Accumulated number of total doses in Thailand now is more than 124 million doses. This brings us to 77.2% of the population having their first dose already, and 71.6% their second dose, and 29.7% with their booster doses or the third dose. As you know, some people have already received their third dose in Thailand. At the same time, there are still, as I mentioned in the beginning, some who have not received the doses yet. There remains a group of people in the population who have not yet, and we will continue to try our best to inoculate those who have not been vaccinated yet. And for those who have, some have been moving from the third to the fourth, preparing for the fourth booster dose, which is good. So on international travel, since we're in the English language presentation, of interest to the audience for the English language version here, maybe on the international travel aspect of it, so of COVID. So the Thai government has approved an air travel bubble between India and Thailand, which is effective from the 1st of March onwards. And according to this arrangement, the commercial flights between the two countries will be allowed to fly passengers from Thai, Indian, Nepalese, and Bhutan nationalities, as well as other nationalities that have had visas to enter both Thailand and India. However, the airlines are required to ensure passengers meet all requirements in line with the two countries' measures to prevent the spread of COVID. So this air travel bubble scheme is expected to get up and running soon. The resumption of commercial flights in Thailand and between Thailand and India will be a factor for this bubble to actually be quite effective. It will provide relief to companies operating the route whose earnings have been impacted by the pandemic and will significantly increase the number of overall visitors to Thailand. Hopefully, of course, with the important measures in place, as I mentioned, the airlines are required to ensure the requirements are met of the passengers between the two countries for this air travel bubble. So just in closing, of course, with the confirmed cases continuing to rise, we continue to request everyone to take extra care by following the universal prevention measures, masking up, visiting and staying in well-ventilated areas, and of course, get vaccinated. So with that, I thank you for your attention and we'll see you again next week. สวัสดีครับ
ครับขอบ